Hello everyone. So in this third section of theories in development of child, we'll be discussing about the behavioral learning theories. Okay, I'll be discussing or explaining the classical conditioning by Ivan Pavlov and B.F. Skinner's operant conditioning, then Albert Bandura's observational theory, and also the theory of hierarchy of needs by Maslow. Okay. So first of all, classical conditioning, it was first described by Ivan Pavlov. So Pavlov, he conducted experiments which involved presentation of food to a hungry animal, which was a dog, along with other stimulus like ringing of a bell. So the sight and sound of the food normally it elicits a reflex mechanism, that is salivation. So if the bell is rung each time the food is presented, the auditory stimulus of the ringing bell will become associated with the food presentation stimulus. Okay, so in a relatively short time, the ringing of the bell by itself will elicit salivation. So classical conditioning then operates by the simple process of association of one stimulus with the other. So step one is before conditioning. So we'll see what happens before conditioning. See, the unconditional stimulus is the one which normally elicits the reflex or the unconditional response. So the unconditional stimulus over here is food, that is meat, which elicits unconditional response, that is salivation in the dog. So in addition, conditioning requires that we initially use a neutral stimulus which has to be identified, and that neutral stimulus has to be associated along with the unconditional stimulus so that it becomes a conditional stimulus. Okay, so here meat was the unconditional stimulus which is causing salivation in the dog, which is an unconditional response, whereas bell, which is a neutral stimulus, is not causing any kind of reflex mechanism. There is no salivation seen, so it's a neutral stimulus. Then step 2 is the conditioning process. Here it involves presenting the neutral stimulus along with the unconditional stimulus continuously and repeatedly. Okay, so the more repetitions, stronger the conditioning. So here the bell was rung every time the dog was given meat or the food. So salivation is occurring in response to the neutral stimulus plus unconditioned stimulus. Now what happens after conditioning? Once conditioning has been established, then we test it. So now to do that, dog is presented only with the ringing bell. So if the bell is rung, the dog starts salivating. Okay, so this response, salivation, is called as conditioned response because it is coming due to the conditional stimulus. Now bell has become a conditional stimulus. Okay, so conditioning has been done now. So even if the meat is not presented, the ringing of the bell alone is causing salivation. So unconditional stimulus in classical conditioning experiment is the one which causes unconditional response. Okay, so in that example above or the experiment which was conducted by Pavlov, unconditional stimulus is meat. Then in actual experiment, Pavlov usually used a piece of meat or a small amount of meat powder instead of meat. Unconditional response elicited by unconditional stimulus. In this experiment, it was salivation. Okay, he had surgically brought the salivary glands to the surface of the dog's cheek so that it's easier to collect the saliva. Then conditional stimulus that is neutral at first, and then in this experiment we can see bell is a conditional stimulus. Okay, so when we associate a neutral stimulus along with the unconditional stimulus, it becomes a conditional stimulus. Conditional response is the response which is elicited due to the conditional uh, stimulus. In experiment we can see conditional response is salivation. So salivation was obtained uh, due to this conditional stimulus is not exactly the same as due to the unconditional stimulus, but yes, it does occur. Okay, so once a dog learns to respond to a particular conditional stimulus, Then, how will the dog respond to similar stimuli? So, a somewhat larger bell was used by Pavlov, but similar tone. So, he compared. So, a somewhat smaller bell was also used. So, these are the just to check, that conditioning has taken place or not. So, conditioning depends largely on how many times that has been repeated. So, when higher tone or high or larger bell was rung, then also salivation took place, but it was lesser than that of the bell with a lower tone. Likewise, the bell which had lesser tone, salivation was less. Okay. So then comes the terminology stimulus generalization. What is that? Similar stimuli with tones above or below the tone of the original will still give the conditioned response, but to a lesser degree. Okay, this is called generalization. So in stimulus generalization, the dog or the person or whatever must clearly see the stimuli as different before reacting to them differently. So now comes the concept of extinction. Now before extinction, uh, in order to begin conditioning process, there must be a conditional response which has to be this extinction. There has to be a conditional response which has to extinguish. So in comparison with the conditioning process, we do not begin with a neutral stimulus. We here begin with a conditional stimulus. Already bell is a conditional stimulus, so we begin with this. Now the bell is rung alone and the food is not being offered, so the bell is causing salivation. This is before extinction. Now during extinction process, repeatedly you present the bell without giving the food or the meat. Now how many times is that necessary? In simple Pavlovian model, stronger the original conditioning, more number of times you need to do the extinction. Okay, so the bell is presented without food many times, salivation is still happening. This is the extinction process going on. Then comes the step third, which is after extinction. So in terms of process, extinction occurs as more and more presentation of the conditioned stimulus occurs with the unconditional stimulus. So here finally extinction takes place. So now when the bell is rung, there is no salivation. Okay. So this was Ivan Pavlov's simple experiment where we understood what is a unconditional stimulus, what is unconditional response, what is a conditional stimulus, conditional response, and how extinction of conditioning takes place. Okay, so this is important to understand generalization when a child generalizes, and extinction process. I'll be discussing it in the question answer part. Okay, now let's see B.F. Skinner's operant conditioning theory. So this can be conceptually viewed as a significant extension of classical conditioning. It has been emphasized by B.F. Skinner. His theories downplay the role of individuals' conscious determination in favor of unconscious determined behavior. Okay, let's see. The basic principle of operant conditioning is that the consequence of behavior is in itself a stimulus that can affect the future behavior. So he says that there need not be a particular stimulus. The behavior itself might act as a stimulus which can affect the future behavior. The consequence that follows a response will alter the probability that the response occurs again in the similar situation. So in classical conditioning, a stimulus leads to a response. In operant conditioning, it is a response which becomes a further stimulus. The general rule here is the consequence of certain response, if it is pleasant or desirable, the response is more likely to occur in future. But if a particular response produces an unpleasant consequence, then there is a probability that the response will be diminished in future. Okay, so it is based on response, consequence, stimulus. Okay, so any stimulus which causes a response will cause certain consequence. If that consequence is good, that acts as a stimulus and leads to same kind of response in future, whereas if the consequence is not that pleasant, then that does not act as a stimulus and there is a probability that such kind of response will be diminished in the future. Okay, so the four basic types of operant conditioning which we need to know are positive reinforcement, negative reinforcement, omission, and punishment. These are the four broad types of operant conditioning. Positive reinforcement, simple terms, if a pleasant consequence follows any kind of response, then the response has been positively reinforced. Okay, for example, if a child is given a reward such as a toy for behaving well during the dental visit, then they are more likely to behave in the same manner during the future dental visits. Okay, so the child's behavior has been positively reinforced. Then comes negative reinforcement. It is the withdrawal of an unpleasant stimulus after a response. So here also comes another terminology which is escape mechanism. So here response that is reinforced is the one that comes after removal of an undesirable stimulus. For example, a child who views a visit to clinic as unpleasant experience may throw a temper tantrum. Okay, so in this so in dental office we have to be careful to reinforce only desired behavior and not to reinforce any kind of behavior which is not desired. So if this behavior of the child, that is the temper tantrum, succeeds, then we'll allow the child to escape the visit. Okay, that will not do any treatment today, it's okay, you can take the child. But the behavior has been negatively reinforced. Now the next time the child visits you, there is a probability that the same behavior will be uh, followed during the subsequent visit. So it is called negative reinforcement. The withdrawal of unpleasant stimulus has caused a response. Okay, therefore it's always necessary to do at least some treatment in the child. Then comes omission. Omission, also called as timeout. It involves removal of a pleasant stimulus after a particular response. For example, a child who is throwing temper tantrum, or his or her favorite toy can be taken away for a short time. Also, sending the mother out of the operatory, that's an important question also, has been asked many times, is also called omission. Okay, if the child is not behaving properly. Then comes punishment. So an unpleasant stimulus is presented after a response. So this decreases the probability that the same behavior will be uh, prompted. Punishment will occur in the future. So punishment, of course, traditionally it has been used as a method of behavior modification, and punishment, like other forms of operant conditioning, is effective at all the ages, not just with children. For example, if a fine is levied, for rash driving, then people are less likely to do so in near future. So reinforcement will strengthen a behavior while punishment will weaken a behavior. So if you give punishment, there are chances or probability of that same behavior occurring decreases with subsequent this thing. Okay, so reinforcement is a consequence that increases the probability of a behavior. On the other hand, punishment is a consequence that decreases the probability of a behavior. Simple. This is a summary. Reinforcement, positive reinforcement, negative reinforcement. Both type of reinforcement are used to increase the likelihood that preceding behavior will be repeated. Whereas punishment, positive is usually omission, and negative punishment, both type are used to decrease the likelihood that a preceding behavior will be repeated. Now let's come to social learning theory by Albert Bandura. Bandura says that learning would be exceedingly laborious task, not to mention hazardous, if people had to rely solely on the effects of their own actions to inform them what to do. So the theory emphasizes mainly on the importance of observing and modeling the behavior, attitudes, emotional reactions of others. Okay. Social learning theory explains human behavior in terms of continuous reciprocal interaction between cognitive, behavioral, and environmental influences. So it encompasses attention, memory, motivation. Social learning theory, it spans both cognitive and behavioral frameworks basically. The general principles: People can learn by observing the behavior of others and outcomes of those behaviors. A simple example I'll give you. If you're standing outside the HOD's room and you need permission for something, but you see that the HOD is scolding the student who's already inside, will you go directly after them right away? No. You'll wait for some time. Probably you'll wait for your HOD's mood to, become good rather than entering right away. So this is you've observed the behavior of the other people and the outcome of those behaviors. So you're acting wisely now. Okay. Learning can occur without a change in behavior also. So here you are not following the same behavior. You are not going inside directly, but you have learned that, you observed that something is happening with others, it should not happen to me. Okay, so behaviorists say that learning has to be represented by a permanent change in behavior. In contrast, social learning theories say that because people can learn through observation alone, their learning may not necessarily be shown in their own performance. Then an important term is cognition. It plays a role in learning. Over the last 30 years, social learning theory has become increasingly cognitive. Okay, awareness and expectations of future reinforcement punishments can have major effect on behavior that people exhibit. And social learning theory can be considered a bridge or a transition between the behaviorist learning theories and the cognitive learning theories. The most common example of social learning theory is the television commercials. So the commercials which come during any TV show, like they might show drinking a certain beverage or using a particular hair shampoo, will make you popular and win the admiration of attractive people. So depending upon the component processes involved, such as attention or motivation, we may model the same behavior which is shown in the commercial and buy the product which is being advertised. Okay, so this is the famous Bobodol experiment which was conducted by Albert Bandura, and he's famous for this experiment. In this experiment, what he did was that he had children witness a model who was aggressively attacking a plastic clown. Okay, that plastic clown is the Bobodol, and the model is aggressively hitting. He punches the doll, hurts it, kicks it across the room. Then the children were sent to another room where they were, their favorite toys, but they were not allowed to touch them. And here, after observation, the process of retention had occurred, and then they were sent to another room where similar doll was placed. So they also started hitting the doll, they got aggressive. So they started modeling the same kind of behavior which they had seen the model doing. So observational learning is also known as imitation or modeling. In this process, learning occurs when individual observes and imitates others' behavior. Okay, so there are four component processes which are involved in this. So the four components include attention, retention, motor reproduction, and motivation. Now let's see what are these. Okay, attention is the individuals, they cannot learn much by observation unless they perceive and attend to the significant features. You have to pay attention. For example, children must attend to what the aggressor is doing in the Bobo doll experiment and saying in order to reproduce the same behavior. Okay, so the children here witness Bobo doll being verbally and physically abused by live and filmed models. Then comes the concept of retention, which is the next component. In order to reproduce a modeled behavior, the individual must code the information into long-term memory. It has to be retained in the memory. Therefore, information can be retrieved when it's required. So simple verbal description of what the model performed would be known as retention. Okay. Memory is important cognitive process which helps observer code and retrieve the information. So in this Bobodol experiment, the children imitated the aggression they witnessed in the video. Okay. Motor reproduction, the observer must be able to reproduce the model's behavior. Once a behavior is learned through attention and retention, the observer must possess the physical capabilities in order to produce the aggressive act. Like if suppose the age group of children used in Bobo doll experiment was less than 2 years, how would they hit the doll? It's not possible because they have not developed that kind of physical strength or capability. So that is also required. So that it is called as motor reproduction. Okay, then motivation or reinforcement. So in this process, the observer expects to receive some reward, some positive reinforcement for the modeled behavior. In the Bobo doll experiment, the children witnessed the adults being rewarded for their aggression. So they performed the same act in order to achieve the rewards. Dental application is as a behavior shaping technique. Basic modeling procedures involve allowing a patient to observe one or more individuals, whom we refer to as models, who demonstrate appropriate behavior in a particular situation. So the patient will frequently imitate the model's behavior when placed in a similar situation. The model may be present, that is patient modeling, or filmed, that is audiovisual modeling. Okay. So whether a child will actually perform an acquired behavior depends on several factors. Important among these are characteristics of the role model. So if the model is liked or respected, the child is more likely to imitate him or her. For this reason, usually a parent or an older sibling is often the object of imitation by the child. So we use or we ask a parent or older sibling, in modeling process. So for children in the elementary and junior high school, the peers within their own age group or individuals slightly older are increasingly important role models, while the influence of the parents usually decreases, okay, gradually. So another important influence on whether a behavior is performed is expected consequence of the behavior. If the child observes an older sibling refuses to obey father's command and then sees punishment following the refusal, he is less likely to defy the father on future occasion. Okay. Another factor is the motor ability to reproduce the model's behavior. It's essential as the child's ability to retain the acquired behavior by mental process. It's as essential as that. So normal children are capable of acquiring any behavior that they observe closely, and that is not too complex for them to perform at their level of physical development. So if a young child observes an older sibling undergoing dental treatment without any complaint or without showing any uncooperation, he or she is more likely to imitate this behavior. If the older sibling is observed being rewarded, and the younger child also expect a reward for behaving well, because the parent is an important role model for a young child. The mother's attitude towards the dental treatment is likely to influence the child's approach. Okay, so research has demonstrated that the best predictor of how anxious a child will be during the dental treatment is how anxious the mother is. Okay, a mother who is very calm and relaxed about the prospect of dental treatment teaches the child also to be calm and relaxed, whereas an anxious and alarmed mother tends to elicit the same set of response in her child. So, as the saying goes, children have never been good listeners to their elders, but they never failed to imitate them. Okay, so there are certain criticisms to this theory. The social learning theory, it advocates that individuals, especially children, imitate or copy modeled behavior from personally observing others, the environment, and the mass media. And the biological theorists, they argue that social learning theory completely ignores individuals' own biological state. Also, they say that this theory rejects the differences of individuals based on genetic, brain, and learning differences. In the Bobo doll experiment itself, we can see that the children, they were manipulated. So the critics have argued that children were manipulated into responding to the aggressive behavior. They were teased, so they became frustrated because they could not touch their favorite toys. So many critics believed that the experiment conducted was quite unethical and it was morally wrong because the children were trained to be aggressive in that experiment. Then comes the next theory, the theory of hierarchy of needs by Abraham Maslow. So this is one of the many interesting things which Maslow noticed while he was working on monkeys during his early career, and that was that some needs they take precedence over the others. For example, if you are hungry and thirsty at the same time, you'll tend to try to take care of your thirst first. So the main reason behind that is you can do without food for weeks, but you cannot do without water even for a couple of days. So thirst is a stronger need compared to hunger. So likewise, if you're very thirsty but someone has put a chokehold on your throat, then you can't breathe. Then what is more important? In that case, the need to breathe becomes the uh, priority. Okay. So Maslow took this idea and he created his own famous hierarchy of needs model. So beyond the details of air, water, food and other things, he laid out five broader layers. Physiological needs, then the needs for safety and security, the needs for love and belonging, needs for esteem and need for self-actualization in that order. This is the basic model where we can see the needs, how the basic needs are the physiological needs, which are the food, water, air, okay, sleep, all those things. Then safety needs, we need security at home, security of the family. However, if, like for example, a family is dysfunctioning, if there is an abusive husband who beats the wife, then such wife cannot, go to high level of love and belonging state unless she is no longer cringing in fear. So this particular need has to be fulfilled before going on to the upper level. Okay, so after physiological comes safety needs, then the love and belonging needs, then esteem needs, then come the self-actualization need. Okay, so love and belonging are the uh, like you need to belong to groups, you have that desire to belong to various groups, to have friends, to or belong to religious groups, to have family, gangs, etc. So we need to be loved by others or accepted by others, you can say. Then the esteem needs, there are two types of esteem needs. First is self-esteem, which results from competence or mastery of a task, and the second is attention and recognition that comes from others. Then last is the self-actualization, that is the desire to become more and more of what one is capable of becoming. Okay, to achieve one's full potential is called self-actualization. Okay. So this is another model, the which has certain other components. You can see physiological needs, food, water, air, safety needs, security, comfort, freedom from fear, attachment needs, to love and to be loved, to have friends, esteem needs, to be competent and to be recognized, cognitive needs, curiosity, exploration, understanding the world, aesthetic needs, harmony, order, beauty. Then self-actualization is to achieve one's full potential. Okay. So Maslow's hierarchy of needs was an alternative to the depressing determination of Freud and Skinner. He felt that people are basically trustworthy, self-protecting and self-governing. So humans, they tend to grow and tend to move towards growth and love. That's what Maslow stated. So as long as we are motivated to satisfy these cravings, we are moving towards growth, towards self-actualization. Satisfying needs is healthy. Blocking gratification makes us sick and evil. Okay. So this is another, he also talks about these levels in terms of homeostasis. Okay, like our body uh, has that principle of homeostasis as far as various organ systems are concerned. When our body lacks certain substance, it develops hunger for it, and when it gets enough of it, then the hunger stops. So likewise, the hierarchy of need models, there are certain needs which have been fulfilled, the basic needs, so they are no longer salient now. Those needs are not that important. Now these are the salient needs, the needs which need to be fulfilled, which have the focus right now. But there are certain needs which are still not salient, because these needs, once we fulfill these needs only, we can come the needs which are next on the ladder. Okay. This theory also faced certain criticism, like his methodology was he picked only a small number of people that he himself declared self-actualizing, and Maslow limits it to something only 2% of human species usually achieve, that is self-actualization. Whereas there are certain other theorists who believe that children are a very important example. Babies are important examples of achieving human self-actualization. Maslow didn't think that it was something which can be achieved by children so young. Now let's discuss one or two questions. So this is a question: a child behaves inappropriately during his dental visit. In response, the dentist sends the mother outside the operatory. This kind of behavior management is termed as A. Positive reinforcement, B. Negative reinforcement, C. Punishment, or D. Omission. So the answer clearly is D, omission, because here the favorite thing of the child has been taken away from him. That is omission, the concept. So the mother is asked to move out of the operatory. That is a known as omission. Now sending the mother out of the operatory will decrease that kind of behavior. Now the child will not throw that kind of temper tantrums which the child was throwing in front of the mother. Then comes second question, which is reinforcement technique is based on A. Social learning, B. Freud's psychoanalytical theory, C. Reconditioning, reassurance explanation, D. Maslow's theory. So clearly we'll rule out social learning theory was given by Bandura, reinforcement was discussed by Skinner in operant conditioning. Freud's psychoanalytical theory is completely different. Maslow's theory is the hierarchy of needs. So the answer clearly is reconditioning, reassurance, and explanation. These are the three things on which the reinforcement technique is based. Then comes another question: a frightened child is exposed to a dental clinic which is pleasant, colorful, and quite different from the previous clinic where a painful experience occurred. So this child is happy and the treatment is completed. The psychological conditioning principle which is used here is A. Acquisition, B. Generalization, C. Extinction, or D. Discrimination. So here the psychological conditioning principle which has been used is discrimination. The child can discriminate between the two clinics, the previous one where the unpleasant experience occurred and the current clinic which is quite pleasant, child friendly, colorful. So the child can discriminate between the two. So the answer is discrimination. Okay, generalization is just the opposite of discrimination. It is when the child generalizes a doctor in a white coat will cause pain. Okay, so or if the child has a bad experience, has had a bad experience in a clinic previously, then if the child visits to clinic which has similar surroundings, then again the child will generalize. Okay, this is the place where the child will feel unpleasant stimulus or environment. Extinction is comes after discrimination. Like if the child visits subsequent at the subsequent visits, if the child has again similar experiences, pleasant experiences, if they occur repeatedly, then finally there will be extinction of fear completely. Now the child does not fear going to the dentist or the dental visits anymore. Okay, so I hope I have made the concepts clear. This is a vast topic, so I had to take it into three sections. Okay, if there are any doubts or queries, you're most welcome to ask. Thank you so much for your attention. Thank you.